Hey there guys, it's Dr. Steve from Elevate Sport and Spine here in Denver. I want to take some time today to talk to you about squatting. So a good squat will allow us to be in a good position with our weight kind of centered over our heels to where we can be good and balanced, and allows us to pick large objects up off the ground without hurting our backs. So I want to talk to you about some of the common faults and things that I see usually with people's squats and kind of how to fix them. So one of the things that I see most commonly is that people don't get enough depth. So with a good squat, we want to make sure that the hip joint kind of right in here ends up below the knee joint. So that allows us to get really close to the ground. Anything that you can get below there is kind of a bonus, but some people have some anatomical limitations that will make it to where they can't really get down through here. Most people though should be able to find a deep squat. Another thing that I see a lot of times is that people like to lean forward a ton to sort of balance themselves because they end up too much in their toes. So when they come down to squat, if they get low, they have to keep their heels up, or if they keep their heels down, they end up having to balance by shifting their weight forward. That can lead to lots of problems in the knees with a squat because it requires a lot more force to come into the quads. A good squat will allow us to kind of externally rotate our legs to open up enough room for our torso to come down in between, and then use the glutes more so than the quads. So if you're feeling a lot of burning in your knees and quads after you've gotten done doing some squatting, then you're likely one of those kind of people that is folding forward or not opening their legs enough to where their knees are coming straight out over their toes out in front. So a good basic setup for a squat is to make sure that your legs are about hip width apart, maybe a little bit outside there, that we can externally rotate the legs just a little bit, no more than about, I would say, 5 to maybe 15 degrees on either side. So just find a comfortable spot kind of in there that allows you to sort of push your legs out as you come down. So a good cue for this is to think about there being a peak of carpet in the floor in between your feet that you are trying to sort of spread out. Without actually moving your feet, what I want you to do is to spread your legs out and then think about twisting your feet down into the ground without moving them too as you spread out, which will kind of get your glutes engaged and engage your core and allow you to drop down. A lot of people will find problems with this sort of thing where they end up only being able to go so far. When you can't go far, there's a couple things that could be happening. You could have joint restrictions that are keeping you from being able to get so deep. You can have soft tissue restrictions like tightness in hamstrings and things like that that are keeping you from getting deep. Or you can just have a motor control problem where your body doesn't really know where it's at in space and won't allow you to get any deeper just because you're not comfortable. Most of the people that have motor control problems, which is the most common thing that I see, is that they just don't feel comfortable being down here this far. They're used to being in their toes, and they always tell me, you know, if they stay in their heels, they feel like they're going to fall over because they're just not comfortable being at this kind of hip below knee position. Which is okay, it just takes some time to sort of learn. So if you're one of those people, then I would start with a progression of squats, just trying to get lower and lower and not being afraid to fall over, because you can keep working on this work, and eventually you will stop falling over. So a good progression to work through for squats is to do the things that we talked about, but start up against a wall so that we can sort of work kind of keeping our chest up and just feeling that depth. So just trying to get down in here, feeling that muscle contraction here, and just getting used to getting deeper and deeper. After that, we can start using kind of progressively lower objects to squat onto. So maybe your favorite chair or a ball or a box. Then we can get into progressively lower things. So this would be a good thing to go to next. So squat onto that. Oh, pardon me. And even lastly, something that's pretty low in general that we can squat all the way down onto and stand back up. Then I would start trying to get rid of the tools and just kind of progressively squatting lower and lower until we get kind of comfortable being down here. Again, trying to focus on the things about keeping those legs torqued down into the ground, really opening the knees out, kind of like you're opening a book, and then just trying to find deeper and deeper positions to sink into. And again, just don't be afraid to fall over. So if you get stuck here and need to shift your weight kind of back from this front part where we're used to kind of being in our toes, but not so far back that we're in our heels, just finding this kind of mid-foot area to hang out in. If you're gonna fall over, just, I mean, you're already down here, just fall over. That's fine, it's not gonna hurt. So just play around with that and see how it goes. And as you get better and better, I would just start with these kind of air squats without using weight. Once you get to a pretty good depth and are feeling comfortable down here, then you can start adding weight to it. Lots of different variations of a squat that you can do. With a kettlebell, we can do goblet squats, which are out here in front, and then we can squat here like this. With a barbell, that can become kind of a front squat, which is where we hold a barbell out in front here and squat. The most common one that most people know about is the back squat, here like this, and then the most complex of all, an overhead squat there like that. Those are pretty much all the real simple tips and tricks to getting a better squat that I know of. A few other things that we can talk about. If you want to stop by the office, we can talk about those as well and see if you have any joint restrictions or soft tissue things that are really stopping you from getting down to the bottom of your squat and being safe while you're lifting and picking things up. So if you have any other questions, feel free to hit me up. Until next time, take it easy.